My name is Amya Smith, and this is my creative oral presentation about cancer. So, did you know that around 18.6 million people live with cancer? Most are diagnosed with lung, breast, or prostate cancer, and the overall survival rate is about 70.5%. Women under 50 are 82% higher chance of getting cancer than men the same age because of the rate of breast cancer and thyroid cancer that is being diagnosed. So, what is cancer? Cancer is a group of diseases where some of the body's cells grow uncontrollably and spread throughout other parts of the bodies. These result in masses, but some cancers, like leukemia, are blood cancers. What are the causes and risk factors of cancer? Some of the main causes and risk factors are tobacco use, excessive sunlight, exposure to chemicals, and family history. So there are 5 main types of cancers. The most common one are carcinomas, which start in the skin or the tissues lining the organs. The second are sarcomas, which are in the blood, the bones, the muscles, and the connective tissues. Third is leukemia, which begins in the blood and affects the blood and bone marrow. Fourth are lymphoma, which is in the lymphatic system, which are in the lymph nodes and infect the immune system. Fifth are myelomas, which develop in plasma cells, also white blood cells. And then the stages of cancer. There are 4 main stages of cancer, but there's one, the cancer, which is stage 0. Carcinoma in situ, which are the cells are present, but they haven't spread yet. And then stage 1 is cancers are small and localized, but they haven't spread to the lymph nodes or the organs. Now stage 2 is when the tumor becomes a bit larger and is spread to the nearby tissues and a small amount of the lymph nodes. Stage 3, the cancer has spread more extensively to the lymph nodes and the tissues, but not the major organs. And then stage 4, which is metastatic cancer, the most advanced, it's when the cancer has spread to the major organs like the brain, the liver, and the lungs. So signs and symptoms of cancer. The most common signs and symptoms of cancer are unexplained weight loss, infections and viruses, lumps or swelling, frequent coughing, pains and sores, unusual bleeding, and fatigue or weakness. So diagnosis. There are many different ways doctors diagnose cancer. The first one are physical examinations. Second is CT scanning, x-rays, and MRI scans. Third are laboratory tests. Fourth are biopsies, which is when a doctor goes into the body and pulls out tissue and scans it under a microscope. And then genetic or molecular testing. Prevention. There are many lifestyle choices that can help with preventing cancer. So, first one is avoiding tobacco, exercising regularly and eating a healthy diet, protecting your skin from sunlight, limiting alcohol consumption, and participating in cancer screenings. So, for treatment and prognosis. For treatment, the 3 main types are surgery, radiation therapy, chemotherapy, and stem cell or bone marrow transplants. The factors for prognosis really depend on the type of cancer, if it has spread throughout the body, your age and overall health, and how the patient responds to the treatment. So, thank you for listening to my presentation. I hope that this helps you learn how to prevent the cancer, learn the types, and learn what cancer is. Thank you.